So a brachioplasty procedure, what is that? Well, you're removing loose skin of the upper arm. That's great for a patient that's lost a lot of weight and is left with a lot of loose skin, and that loose skin can't be removed by exercise. It involves making an incision from the axilla down the arm to remove that skin. Typically in plastic surgery, we can hide scars. In a brachioplasty, it's important to be aware that you will have a scar on the middle of your arm. Now, sometimes that's really worth it for someone who has a lot of skin and wants that removed. If you don't have that much loose skin, sometimes that's not worth the scar. So that's a conversation that we have. In a brachioplasty, we remove the loose skin by excising it, and often we do liposuction as well. So we perform a brachioplasty in the accredited surgery center. We perform this surgery in an accredited surgery center under general anesthetic with an anesthesia provider. Typically the procedure takes anywhere from 2 to 3 hours. After surgery, you will have a compression garment on your arms to keep that swelling at bay. I will see you the next day to make sure that the skin and incisions are healing well. Recovery typically involves some soreness that is well controlled with your pain medication, and typically after a few days, patients aren't even taking the pain medication. Depending on what you do, you can usually return to work within 5 to 7 days. Restrictions, we don't want you doing any strenuous activity, heavy lifting, straining for the first 6 weeks after your procedure, because we don't want to put at risk that incision and maybe a wound healing issue. So that's also why it's important that I want you wearing your compression garment for about 24/7 for the first 6 weeks. There are risks of a brachioplasty, just like any procedure. They are low but can happen. Bleeding, infection, a widened scar, or changes in sensation of the arm. There can also be seromas, which is lymphatic fluid, so that's why it's really important after your surgery to wear the compression garment that we give you. So a great candidate for a brachioplasty or arm lift is someone that is left with a bunch of loose skin after maybe weight loss, or even a patient that just as we age, we tend to have looser skin of the arm, and we can make a big change with the contour of the arm. We'd love to see you at your consultation. If you have more questions, make sure to write them down. We'd be happy to answer them for you at your visit.